Hello, everyone, and welcome into Senior Living Live. My name is Melissa. Thank you so much for being with us via video and podcast today. Well, if you or a loved one suffers from arthritis, you're going to want to RSVP for our upcoming webinar February 9th at noon Eastern. It's called simply All About Arthritis. And we've got one of the nation's leaders in joint repair, Dr. Donald Hohman, back on the show today to give us a preview. Dr. Hohman, good to see you again. How are you doing today?
Thank you very much. Very well, thank you.
Excellent. Well, some of our viewers may remember you from your previous webinar with us about bone and joint health. For those who may not know about you or who you are, can you tell us about yourself and your practice?
Sure. I'm a board certified orthopedic surgeon. I'm in private practice in Dallas, Texas. I specialize in joint replacement. I did my fellowship in adult reconstruction in Boston, and then I moved to Dallas, and I've been in practice here since then. I am, I guess, what I'd refer to as an arthritis surgeon. So I take care of people with all forms of joint disorders, from young people with rheumatologic conditions that lead to the destruction of their joints to people who, maybe have had an injury and wind up with a post-traumatic arthritic condition, or even people with just run-of-the-mill wear and tear arthritis, which would be one of probably the more common things that we take care of. And so not only do we do surgery for these people, but the vast majority of the people that we take care of, we just help manage their symptoms and try to get them, better with non-surgical treatments such as, injections and bracing and all the other, non-surgical options. We offer, kind of comprehensive musculoskeletal care. And then on the surgery side, when people run out of these things that they can't manage with non-surgical means, we offer full comprehensive care for joint replacement, whether that be a partial knee replacement, patellofemoral replacement, lateral partial knee replacement, all of these kind of things in the knees. We do those. We do full knee replacements. We help people with problematic joint replacements. So if need be, if somebody has an issue with a joint replacement, we also do revision joint replacements. And then when it comes to hips, it's pretty much a very similar story when it comes to hips. So we do the full array of non-surgical management options, including all forms of injection therapy. And for people that do need hip replacement, we also help people with, what I tell people is my best operation, and that's minimally invasive muscle sparing anterior total hip replacement. And then we also take care of problematic joint replacements around the hip as well. And if need be, we're happy to help people, figure out what might be wrong with their hip replacement. And if need be, we can redo their joint replacement as well.
Yeah, it is really incredible to see how far advanced in terms of technology we've come in the replacement of your hip and your knee replacement surgeries, and people are up and walking and doing great very shortly after surgery. And I know somebody in particular who said, "I don't know why I waited this long to do it." So when we thank you for all the work that you do, certainly to help others get out and live their life to the fullest. And that kind of leads me to the next question in discussing arthritis in general. For those of us who have it, got a little bit in my knees, we know it hurts, and we know that it keeps us from being as active as we would like to be. But can you explain what causes it and why is it so painful?
That's a really good question. So arthritis is one of these conditions. And so I always preface these comments with, if we're going to use the term arthritis, we're going to be referring to run-of-the-mill wear and tear arthritis. So this is not the rheumatologic type arthritis, but run-of-the-mill wear and tear arthritis is caused by a lot of different factors. So the more we learn about this, we actually are learning that we don't really know. So there's a lot of things that kind of go into this. And, there are some genetic components. For whatever reason, sometimes women seem to be a little bit more prone to some of these things, more so than men. There are anatomic things that can lead to some of these early conditions, sometimes like the shape of your leg or the shape of your hip. Some of those things can predispose people to early deterioration of the joint. And really the process is, it's as much a mechanical issue for these people when the surface wears off of the end of the bone. And so the nice cushiony surface is no longer there. And that's what leads to just a sort of a progressive irritation, a high friction environment within the joints, and just kind of feeds forward. there's a response to the surrounding soft tissues, and it's a slippery downhill slope once these things get started.
Yeah, and I'm glad you mentioned that, because there are 100 different types of arthritis, and we're certainly not going to go through all of them today. So I appreciate you sort of simplifying the sort of, as you said, run-of-the-mill arthritis that I think many of us get just through the normal wear and tear, as you mentioned, of day-to-day movement. But how do you go about diagnosing arthritis, and what are some of the maybe biggest misconceptions people have about it?
Well, we joke in the joint replacement clinic. We have the poor man's MRI, which we start with just your routine X-ray, and so a lot of times you can identify people with these run-of-the-mill wear and tear conditions just with a plain X-ray. And it also starts with just talking with people, people with these kind of common conditions. They have very common kind of complaints and stories, and the way that they wind up making it to your clinic. Um, it's you know oftentimes really textbook. People start to have issues, and they start to modify their quality of life and start changing their normal daily activities, and start living their life around their arthritic joints. So they'll stop walking the dog after dinner, and those types of things. But then it can be a little bit more involved, because some people with these rheumatologic conditions, sometimes you'll meet people for the first time, and they'll have an issue with their hip or their knee or something else, or maybe it's a bunch of joints in their body, and you kind of got to start down the process of figuring out why that might be the case. And there's some blood tests sometimes that can be important to help guide people through the system, because not everybody with arthritis needs a surgeon, and not everybody winds up with a joint replacement. A lot of these things can be managed with medicines. And sometimes we have to get people set up with a rheumatologist, or maybe they need their primary care doctor, or sometimes somebody will show up and think they have hip arthritis and they've got a stress fracture in their hip, or there's all sorts of variations to the presentation. And so common things are common, but oftentimes you got to sniff out some of these other things that can show up too.
Yeah, so maybe in terms of misconception, people coming in thinking they've got one thing, and then come to find out after taking a little bit of a deeper dive, find out, oh, that's not exactly what I thought I had, and
No
that's
question.
obviously
Yeah.
part of your job, yeah, and helping people get to the root of the problem. Now, earlier you did discuss a couple of tips, or not tips, but literally treatments that you use for management to help alleviate arthritis pain. So today, can you maybe share one treatment option? We know you'll speak of many during your webinar. We don't want to ruin all that today, but maybe one option or technology that you feel really excites you in terms of arthritis management.
Well, in the non-surgical realm, there is a lot of research that's actively going on with a lot of different injection therapies right now that is really kind of exciting. And so, the more we learn about kind of capturing some of these people early on, can we help them, avoid needing, joint replacements? Um, and so, the world of injections is really kind of, I guess, in its infancy, but we're learning more about it. And so, the application of platelets as treatment options, and can we take the growth factors from the platelets, and can we inject those in an early hip or a knee, and can we help that joint survive longer? And is there some repair process that we can kind of stimulate and help keep that person with their own parts, for as long as possible? Because it's like I tell all of my patients, you're always better off with your own parts. If there's a way that we can save your surface, obviously you're going to be better off and happier with that for the long term. So from the non-surgery standpoint, a lot of the injection therapies are really kind of exciting and really very interesting. And then on the surgery side, like you had alluded to earlier, the one of the things that's the most exciting about the surgery side is that the big advancements in the last probably 10 or 15 years in orthopedics, they haven't really been the materials side of all of this, but really the management of the patient around the time of the operation. So one of the things that we're really pushing the envelope with is, we're routinely doing what is a really big operation, say a hip replacement or a knee replacement. And, we're so good with the management of the patient around the time of surgery that they're home even within a few hours after the operation. And those kind of things are really, it's really rewarding when you can, put all of these pieces of the puzzle together, and it all works, and everybody's home and safe, and they're, sleeping in their own bed, and eating their own food, and recovering, and off to the races quickly. that's really rewarding and it's really exciting. And, we're constantly fine tuning the process, and it's working better and better.
Yeah, and I'm sure leading people to seek out the treatment as opposed to maybe back in the day when they wouldn't because of everything that was involved in the management side on the back end
Yeah.
of surgery. Yeah, great, great. Thanks for sharing that there. And as we start to wind this down, what can somebody with arthritis do today? Like literally, as soon as they get done watching this, that can help them get through these last few months of winter with just a little less pain.
That's that's a really common question, but also probably the best question. And this is like I tell all of my patients also, there's always something all of us could do a little bit better. So so for example, just healthy living, because everything that you do, your joints there, just think of them like organs also. And so, for example, people with diabetes, your diabetes health is important for your joint health also. And so maintaining control of your blood sugar is important. If you're a smoker, smoking can also, have detrimental impact on every system, and every organ. And so, those are the things that have been shown, to help your back pain, help your, whatever the issue may be, healthy living and staying active. And so, if you do have, say, a badly arthritic knee and you used to love to run, like me, I used to love to be a runner. And so, I can't, my knee hurts me too bad to run. So now I have a bicycle. Now I'm not crazy about my bicycle, and I'm worried about getting, hit by a car or something every time I'm riding it. But I am able to do that, and it does help my knee. It helps my knee pain, and so whatever that form of activity is that's comfortable for you, whether it be maybe you're in a in a pool or something, because I know that these bad surfaces, it's painful to get around on them, but just moving the joints, those can be helpful. Small
Yeah.
changes in healthy habits can make a big difference.
Perfect. And life is all about adjusting. You can't do what you used to do in your 20s when you're in your 40s, 50s, and 60s for sure. Um, Finally, our viewers will have a chance, of course, to ask you questions during your webinar. But if they want to get in touch with you or your practice now, maybe they've got questions, how can they do that?
The easiest way is if you just give us a call. Our on our office phone number, somebody always answers the phone, and then we have somebody that can help triage people depending on what they need, and help direct you to who you need to speak with. And so we have really expert team people that are readily available every day of the week to help us out. We have a lot of information available through our website. um, we try to be active on social media and respond to those kind of things also. And so um, we try to be as interactive and engaged with people in any way that we can. And it's a fast paced digital world. And so one of the things that's hardest for us is it's just like returning phone calls. People try to get to us during normal business hours, but we're operating during normal business hours, and so it's hard to get back right away. But we try to keep up with all of that stuff and make as much information available to people as possible.
Yeah, and then the social media certainly helps. People want to see sort of what you've been able to do, the proof in the pudding, if you will, with real
Yeah.
life people. And social media definitely helps to do that. And I love that so much. Dr. Hohman, it is always good to see you. And we thank you so much for taking time out of your busy schedule to be with us today.
Oh, you're kind. Thank you so much.
Yeah. And we, of course, look forward to your webinar, All About Arthritis, February 9th at noon Eastern Time. For those of you watching, don't forget to head on over to www.seniorlivinglive.com to RSVP. We will see you all again February 9th.